Hello, and welcome to another episode of Insights. My name is Bill Russell. I'm a former CIO for a 16-hospital system and creator of This Week in Health IT, a channel dedicated to keeping health IT staff current and engaged. Our hope is that these episodes serve as a resource for the advancement of your career and the continued success of your team. Now, on to the show.
Today on Insights, we go back to a conversation host Bill Russell had with Michael Meucci, COO at Arcadia, and David Dirks, VP of Strategy at Intermountain Castell. The topic of discussion was a COVID health data supply chain case study. Collecting and analyzing data during the pandemic has been difficult, to say the least. The health data supply chain seems to be a better way of not spending as much time normalizing the data and spending more time actually generating benefits for the organization. But how exactly does it do that?
It seems to me the health data supply chain is a different concept, and what it gives you is agility. And one of the things we just came through with the pandemic is that we recognize the need for agility at a pace we've never had to experience in healthcare, at least in my lifetime, where we didn't know what the problem was until the problem presented itself. And then it was sort of almost like the demand generated the need, and then we had to figure out how to respond to it. And the health data supply chain seems to me to be a better way of not spending as much time normalizing the data and spending more time actually generating benefit for the organization. Michael, does that capture it? And how does it do that?
Well, yeah, I think that captures the essence. And I think what we're trying to turn on its head is, and COVID is a great example. And we have a great story about how we partnered on that rapid response. March of 2020, when there was the beginnings of shutdowns and stay-at-home orders and all of the changes that have become part of normal life over the last 18 months, the conversation that Dave and I and a bunch of other folks had was, how do we figure out who are the patients who are most likely to die from this disease that we know very little about? And where the health data supply chain came in is we said, well, hold on. Arcadia has a reference data set. It's about 150 million persons that we've collected. We do a bunch of research on it. And we have customers in Boston, New York, and Seattle, three of the earliest outbreak centers in the United States. This was a time where testing was widely unavailable. You had some skunkworks testing projects going on in different cities. But what we did have was diagnosis data coming in from ADTs or from EHRs. And so we were able to build a little machine learning model. And I say that, and it's not anything fancy. It was pretty simple at the time to say, what symptoms are we seeing that tie to what the CDC is reporting we should be watching for, that tie to the limited number of positive tests that we have, so we can then back into a registry of risk factors. And everyone at the beginning of the pandemic said, hey, it seems that folks who are overweight or folks with multiple chronic conditions, elderly, are more susceptible to complications from COVID. But that was just a hunch. And so we were able to build these models, get them in the hands of Dave's care traffic control team, and really rapidly spin up an outreach program to those patients. And Dave can talk about the outreach program. But what was great about the supply chain was, like any traditional supply chain, there's always an effort of supply chain optimization. We were able to take feedback from their calls and use it as an input to the model to help the model get smarter. So as we continued to build these risk strata and cohorts, they were getting smarter and more refined each time. And I think Dave can speak to some of the great findings and some of the great support that Castell and Intermountain were able to provide to their patients through these efforts.
Yeah, I mean, if you think about where we were at that point in time, right, the delivery system was all reacting to the surge. How do we stand up testing? And it was in a very reactive position by necessity. And the conversation was, how do we begin to get ahead of this? How do we begin to some extent, begin to take the fight to COVID and what was happening? And one of the key roles that we at Castell felt like we could play, because in all of the other components, we felt helpless, right? It was our ICUs and EDs and others sort of fighting that battle. We said, how can we identify those folks that are in their homes, they're scared, they have a lack of information, they don't know what to do if they get symptoms, they're very concerned. The Arcadia team was very quickly able to generate that list for us that Michael walked through. And then we had resources that literally just began making calls and saying, hey, we're concerned about you. What can we answer? How can we help? What that then evolved into, because we already had that supply chain built, is when it became time to get the word out about vaccines, we already had those lists. We already had connections with those folks that we knew were high risk. And so we were then able to begin to make those connections and say, do you know now you qualify for the vaccine? What questions can we answer and concerns? What we were also able to do is leverage technology through those lists and through Arcadia to do that through a text campaign and through calling. We were able to get some uptick, numbers in the hundreds of people that we were able to call and get a vaccine, but it was in the tens of thousands of people that we were able, through that data supply chain, to actually get confirmation on vaccines, or at least a message out through texting. So because that supply chain was built, because we had already had that connection point, as COVID evolved, we were able to meet the needs of people all along that continuum as the sort of the disease and the pandemic played out in a very easy way, where we weren't trying to re-engineer things multiple times, and we were very reactive and able to move very quickly based on the changing nature of how the virus progressed.
Wow. Thanks for tuning in. Another great episode. If you have feedback for us regarding this content and materials, or if you would like to help us to amplify great thinking to propel healthcare forward, which is our mission, please send us a note at hello@thisweekhealth.com. Thanks for listening. That's all for now.